Okay, today I will be initiating IV to my patient, and before I go to my patient's room, I want to double check the orders to my MAR, and after determining that, I'm going to go to my patient and look at his arm. Knock, knock, knock. Hello, Mr. Armstrong. My name is Bianca, and I'll be your nurse today. How are you? He said he's okay, and I want to double check two identifiers, and after determining that, I will be explaining to the patient the procedure. And I already determined that my patient will be needing 22 gauge. And so I'll be washing my hands and I'll provide privacy. Okay, and I'll be setting my table. I also asked Mr. Armstrong to put his arm on dependent position beforehand, just so the blood flow will be good later on. And while doing that, I'll be preparing my stuff. Make sure that's everything I need. What I want to do is prepare my door lock, my port here, so it'll be ready later on. Before I flush my patient. So, before opening my packages, I want to make sure it's intact, it's not expired, and then I got the right materials. So I want to do that and make sure it's the right one, and it's not expired, and it's not tampered. The same thing with this syringe. So I got a 3 ml syringe here. So what I'm going to do is take the air out. Prime it. Oh, there you go. And so there's no more air. What I'm going to do is just connect this one just so it's ready when I flush my patient. Okay, and now I want to get my tourniquet. Oh, before doing anything else, before I forget, I want to have some tape ready, because sometimes it sticks to the gloves and it's pretty hard to take them off. Oh, see, I'm not even using gloves and it's still pretty nuisance. So now, Mr. Armstrong, I'm gonna go check your veins, see which spot is good to put your IV. Okay. So I am palpating my patient's arm and trying to see which one is good vein. And I determine that this is a good vein, so that's what I want to use. I'm going to take the tourniquet off again, and just to make sure, I'm just going to sanitize my hand and wash my hands again and put my gloves on. Actually, these gloves that came in the package, so I'm going to use that. Okay, open my cap, the 22 gauge. So I got my gloves here. Just sanitizing my hand. I'm going to get in my gloves. Out of the way. Alright, Mr. Armstrong, I'm going to have to put you this cap. Now what I want to do is put the tourniquet back on, just so I have a good vein pop in. Make sure I don't leave it on for longer than 2 minutes. So. Oh, before doing that, I'm sorry, maybe I'll take the tourniquet off. I should clean my patient's arm before putting the tourniquet back on. Is that don't want my patient to okay. So what I want to do is clean the spot that I found earlier. Clean it from inner to outer. Make sure it's all clean. I'll discard that. Now I could put my patient's tourniquet on. Okay. Now when I put it back, oops. Make sure I use a 10 to 15 degrees. Okay, let's see if there's flashing, the blood return. And if I see flashing, I'm gonna advance more and push all the way. And I'm just wanna put a support here while I pull this out. There, here to click. And what I wanna do is put the port. So this thing is pretty hard to open. Okay. Make sure it's lock in there. Okay. Trying to stabilize my catheter right there. So, okay, once it's on there, I want to grab a tape just to support my catheter connection right there. See, I could have grabbed a longer one, but I just want to double it just so it'd be more stable. Oh, I should have, once I poked the patient, I should have take off the tourniquet right away. So I should have done that before putting the port. And after that's stable, what I want to do is put the Tegaderm covered. I'm not really familiar using this. No, this is backwards. Okay. All right. Once not, it's now secured, but I have to still check my patient's tubing if it's patent. So what I want to retract first and see if there's any blood return. So once I determine that, I want to infuse 3 ml normal saline there, see if it's patent. And after doing that, what I'm going to do is take this thing off. Oh, before doing that, I just want to have some tape ready. Actually, I could just take my gloves off. Wash my hands, and I got some tape ready. So the entire time I am assessing for redness, any warmth, any abnormalities on my patient's skin. Oh goodness. This tapes. sure it's looped right and it's not dented. So I just want to tape it here. Maybe I just want to tape it this way. It's easier. There you go. Okay. So after doing that, I will set up the pump and the tubing. Just want to lock it, and I'm going to clamp it and discard all the things that I used. Okay, before setting up my pump and my tubing, I want to make sure also to label the IV site that I just did. So I'm going to just put it right here on the side, fill it out. So I want to make sure to do that. Okay, now I'm going to set up my tubing in my bag, and again I'm going to double check my orders and see if I have the correct order. Right now I have 0.9 sodium chloride, 250 ml, and my order says it's 125 ml per hour. So I want to do that. So checking my packaging, it's okay. It's not tampered, it's not expired. So I want to just squish this, making sure there's no leak. So I'm good with that. And now I'm going to check my tubing, making sure it's the right one, it's not expired, it's the right tubing. So got that. Open it. Oh, before doing that, I could have washed my hands. So wash my hands first. And now what I want to do is just spike my bag. So if that happens, kind of contaminated, I want to make sure to clean it with alcohol or Red Pad. It's just really hard to put it in. There. Okay. Now I want to hang it. Press this, fill this at least half full. Okay. Now what I want to do is check my cassette. Oh, it's all tangled. Okay. Now I want to fill it in. Make sure it's not occluded, it's not dented, it's not kinked. So I'm going to open it. Right now, I want to make sure those bubbles are filled. Okay. Now what I want to do is invert it, make sure that the thing is filled. After doing that, I just want to close first, meantime. And then I want to go to the sink. This time we don't have a sink, so I'm just going to use a cup to prime it and make sure there's no bubbles. I'm following the line. Make sure I don't miss anything there. So it looks like it's okay from here. Okay. So yeah, there's a lot of bubbles right now. And after taking all these bubbles off, usually takes a little while, I want to put my cap off. Actually, before doing that, I want to turn my cassette close. I'm going to close my cassette first. and then recap. Okay, so now I'm gonna put my cassette on. Just want to make sure it's open. Set it up there. Close the lever. Okay. So I want to say cassette test in progress. This is my primary, so I want to get A. And I want to double check my orders again. My order says 125, sorry, 125 ml per hour. And then I got 250 right now, so I just want to put 230 right there. So it says here it's gonna flow an hour and 15 minutes. Before doing that, also I want to set it on the floor where I'm at and what medication, which is sodium chloride. But with this pump, we can't find sodium chloride, so I'm not sure why. And with that, I want to hook my patient now. Just move my bowl here. Okay, so before doing that, my cap is on anyway. What I'm going to do is wash my hands, don my gloves. I just want to make sure my port is clean too, so I want to get my alcohol prep pad, clean my port right there, and then I just want to hook my patient. Just make sure to take this off. Right there. And just twist it. Okay, and now I'm gonna push start and see how it's flowing. Make sure this is not clamp and this one is not clamp also. Okay, now it's gonna flow. And now I want to show you how to discontinue an IV and remove my tubing. So what I want to do is stop my machine first. So I'm gonna press stop and I want to clear it. Go up and clear and make sure program options actually make sure okay, it's all now clear and it's stopped. Now what I'm gonna do is remove my patient port right here. Actually, I should be changing gloves, but I'll be just removing this one. And I'll just set it right here. Oh, I almost forgot. After hanging my bag, when I was initially setting it up, I could have put my label, this one up here, just so the nurses know when did I put it, what time, what date. It's right there. I could have put it. Anyway, so I'm gonna take my gloves off. I just wanna take this lever out and just dispose this. And I'm gonna wash my hands, don another gloves, and now I wanna, actually with this one, I really wanna put some gloves on because it might have blood return. So I'm assuming I have gloves right now. I just wanna flush first, just to remove all that debris, if there's any, from that patient. I just want to take this cap off. And then prime, oops. So I want to flush again, 3 ml. Make sure it's not clamped. Flush, and after doing that, I just want to remove the tape slowly. Right there. Make sure I have gauze and bandage. Slowly. and straight back. Put pressure for two minutes. Make sure good pressure in there. And I want to put some Band-Aid on. I'm going to have the patient hold it for me and just put good pressure on. And I'm just going to take this off. Maybe use some washcloth if it's sticking really hard. Take all my trash out and record my findings.